Hello everyone. I wanted to do part 2 of how to know whether or not surgery is the right option for you for pelvic organ prolapse. I got some really great questions after my video last week, whether it was in the comments, whether it was through like a DM, whether it was through an email, and I just wanted to clarify a few things. My job is not to say or prevent surgery, right? Like my job is to help you make a decision and find the resources that is going to best support what you and your body need. And so there are a few things that go into like this decision of whether or not you want to have surgery or need to have surgery. And a big one is you have to be able to really wrap your head around the recovery period, but you also have to really make a decision based on, is this going to improve my life, right? Because right now, if you are unable to lift your kids and you have 2 kids and you're pregnant with your 3rd, for example, is pelvic therapy and a pessary going to allow you to live the life that you really want? Or is surgery going to be something that you need to consider or think about? And I think, again, like some clients that make that decision, there's a lot of guilt around it, and there really shouldn't be guilt around it. You're making a very informed decision based on your quality of life. I will say, I typically won't recommend considering surgery until you're done having children, if that's a choice. And there's a couple of things to consider. So like if you're hypermobile, you have Ehlers-Danlos syndrome, or if like prolapse is something that's in your family that you've seen experienced by your mother, by your grandmother, sisters, those kinds of things, it's possible that you want to have that consult after having kids, right? It's going to be something that's important to consider because it can worsen. And I always tell clients, like, pelvic floor muscle training, pelvic floor therapy can absolutely benefit with symptoms, but we can't change the anatomy. And I think that that's what's really hard for people to swallow, is it won't actually lift up just with like pelvic floor muscle training. So that's why we say Kegels are not the answer. They're not going to change the actual prolapse, but you might become less symptomatic. You might not notice as much. You might be able to do more things with right pelvic therapy, right? And so that's a consideration as well. And I think that, again, there needs to be less shame and guilt around making this decision and more just supporting you and your resources and giving you resources and providing you like absolute like access to those resources. Because again, it has to be an informed consent thing and an informed education, because you have to have all the education around it. There are so many different types of surgeries for bladder prolapse. There's a few different types for rectal prolapse, rectocele, different ones for like lifting up everything. And I think, again, having a provider, whether it's a pelvic PT, pelvic OT, being able to sit down with you and go over each and every one of those surgeries and which one that your surgeon and your doctors are recommending can be so beneficial, because then we can talk about the postpartum or the post-op rehab. We can talk to you about how long to expect to have those symptoms, how long until the scar tissue improves, how long until you're able to feel correctly, how long until you can have sex, and all of these different things. That's where we as pelvic therapists come in, is really for that pre-op, so preparing the pelvic floor muscles and tissues for after the surgery and for the surgery, but also for the post-op options, right? So like being able to know what that rehab plan looks like. So last week we talked a lot about those decisions and things, and I think this week it's important to remember that, again, like this is a personal decision. You can't base your decision on what your best friend did or what your mom did or all of these things. If you're suffering, there are options, and that's something that goes against a lot of other pelvic therapist mindset, right? Because most pelvic therapists and most physical therapists are going to say, don't have surgery, never have surgery. I have prolapse. If it were worse than it is, and if I were fully done having kids, knew I didn't want any more at all, as active as I am, it's something I've considered. And I also consider, again, like other things to think about. If I get pregnant again, do I want to have a C-section versus a vaginal delivery? That's also an option that there should not be so much shame around. And I think, again, like considering what works best for you is what is the most important consideration. It's so important for you to consider those things and to know, like, okay, this is impacting my life. I can't lift my kids. I can't exercise. I can't do all these things. What are my options, right? And then if you're having a baby and you already have pretty severe pelvic organ prolapse symptoms, there are other options for a C-section if you want to do that. That does decrease the symptoms a little bit. For postpartum, you'll still have them during pregnancy, but it won't necessarily add increased risk of more prolapse during a vaginal delivery, if that makes sense. And again, people don't want to talk about that. There's a fear around that for me, just living with prolapse, where if I get pregnant again, am I going to be severely symptomatic postpartum? Is it going to get worse? Is it going to go from a stage 2 to a stage 3? What are my options? And I think that that's important, again, that those are talked about, and that it's actually an opportunity for you to ask questions and for you to know what those risks are. I think there's just so many ways that we can go about this conversation. And really, at the end of the day, I tell people, as a pelvic therapist, my job is to support you in making decisions that are best for you. Not best for me, not best for my comfort, not best for what it is that I think, but I've been hearing stories and emails and DMs and comments and everything about when I started talking about this, that your provider is telling you don't have surgery, it'll get worse, and all these other things. But remember that you're the one that's living with it, and you have to make a decision based on that. So find the providers that are willing to truly go in depth. Now, yes, there are risks with having surgery. There are risks that you're going to have more surgeries later on in life. It's always a risk, right? And like being able to understand, okay, how can I decrease that risk? And those are where the things like pelvic floor therapy and all of that comes into play. So many things to think about, right? So many things to consider, but I'm open to the conversation. I do sessions all over the world with people making this decision to just help guide you, find resources, understand your options. We go over what a pessary is, if you're a good candidate for it, should you consider surgery, and like going through all of that. So I'd love to see you. I'm also this fall starting a pelvic organ prolapse cohort. I will offer this once to twice a year moving forward, but my first cohort starts this fall. Anyone from anywhere in the world can get in. It's all about pressure management. It's all about understanding your type and stage of prolapse, understanding what you need to be doing to prevent further issue, and we will go into some of the surgeries. I will discuss some of those treatment options. It's going to be a really wonderful community of knowledge. So if you want that, those links are down below, and just remember that you're going to make the right decision, because you are worthy and you are okay and you are safe, and there are options out there.